All right. We are here with special guest today, Dr. David Itskevich. I've known him for quite a few years. I'll let him kind of speak on his new practice that he's building up, but he is a fellowship trained, double board certified in physical medicine and rehabilitation, pain medicine. A lot of big words we'll kind of dive into in a minute. He specializes in spine care and also orthobiologics. He uses interventional ultrasound to provide a comprehensive treatment plan, and he really tries to focus on the underlying source to find pain and dysfunction. He's also been recognized for pain medicine and collaborative care, lecturing on such topics as musculoskeletal ultrasound, regenerative treatments, and also osteopathic manipulative medicine. So, David, thank you so much for joining us.
Thank you for having me.
Of
This is a
course.
great opportunity. I really appreciate, being able to chat with you today.
Yeah, more than happy to have you on. We're physical therapists that love to help people who like to exercise. So I always like to ask people if you could only do one form of exercise for the rest of your life, what would it be?
I would go with squats. If there's one exercise that you could do, we sit on those gluteal muscles all day. A lot of us do that with our, desk jobs and all. You and I are a little fortunate to be able to get around and work with patients, a little more hands-on. But, these muscles are so important. The gluteus maximus, for instance, that helps stabilize your pelvis. We're sitting, we're shortening our hip flexors, and that pelvis gets tilted forward. And that's really the floor of your core that we just kind of neglect. That's such a crucial muscle that helps propel you when you're walking. And it just kind of like atrophies. If you don't use it, you lose it. And that's that's a very clear principle in musculoskeletal, health that we encounter all the time. And you can even modify it so that you can add on gluteus medius. So when you're doing a squat, you try to kind of split the floor underneath you as you're doing it. You can even do a little more standing core act, bring a knee up to your chest. There's so many different things that you can do with it, but that's one that I think your center of gravity is right by your sacrum. So if you don't have that strong glute max and your SI joints are not aligned properly, then that's going to make work, movement less efficient, and people get tired. So a small little intervention like doing some squats every day can have profound improvements in health.
I love it. I love squats. Tell my clients all the time how important squats are. It's just a foundational movement. If you want to get out of a chair, you've got to do a squat. If you want to go to the bathroom, you've got to do a squat. So, sometimes people say, it hurts to squat, but I'm just never going to squat again. And I say, well, that's not quite how your body works. So, love the choice of squats. So, your bio is awesome. Your bio is very impressive. I know your history, but a lot of big words in there. So let's try and break it down a little bit. So, just in general terms, so who's the type of person that you like to help the most? Like, who's the type of person that's coming into your clinic?
The patients that I enjoy treating are the ones. Well, like I enjoy treating all patients, but the ones that are really intriguing are the ones that are very motivated to get better, have done a lot of conservative care, worked with great conservative providers, PTs, chiropractors. Even you guys are awesome. And if for some reason somebody's not making progress, and despite we get patients all the time that say, I do all the exercises, but for some reason I'm not making improvements. I want to kind of try to figure out why. And there's a lot of tools, that we have at our disposal to try to figure out why certain muscle groups are not engaging, why compensatory other muscles are tightening up, trying to pick up the slack and make up for the weakness patterns that patients have. And, some simple interventions can make a big difference. And then they go back and do the physical therapy and they're able to achieve their goals. So patients that are already like motivated to get better and have specific goals in mind, I love working with those patients and I love being as part of their team along with you guys to try to achieve those goals.
Yeah, I think that's great. We've shared clients over the years, and so it sounds like I know this, but just from your answer, it sounds like you have a very collaborative approach with other healthcare providers. So for example, somebody might have back pain and they're not getting better with whatever treatment they were doing. They might come to you, and really sounds like you're almost trying to be a detective and look at all the different pieces about why they might have back pain. Am I summarizing it fairly well there?
I love solving puzzles. I do. And, I'm not just talking about like Sudoku and all that. But I mean, you have a patient come in and it could be a challenging Sudoku kind of, you really I really try to figure out not just where the patient's pain is coming from, but all the different contributing factors. So if there's a torn disc, for instance, causing back pain, we don't just treat the MRI. First, I try to figure out, does the history line up? Does the physical exam support that that imaging finding is really the source of the patient's symptoms? And then if it is, what led to that? Was it just one acute, event that could have caused that injury? Or was this a cascade of events that led to that injury? Because there's a lot of supportive structures around that spine, for instance, that could have led to things falling apart. And for years, patients might be able to compensate well, but then eventually it takes its toll, and there might be that like straw that broke the camel's back, not to use that pun. But anyway, basically that we can intervene on. We try to gather all the puzzle pieces, and with the use of diagnostic ultrasound that is unfortunately not commonly used in the spine world, but gaining more traction because there's such a utility for it. When looking at different ligaments, muscles, fascia, you could see joints, and understanding, then taking it one step further, understanding the implications of some injuries to these structures, how they can cause weakness patterns, fascial tears, how restrictions in the fascia could cause some of these tightness patterns that patients experience, how ligamentous injuries can cause instability and even sometimes refer pain into an upper or lower limb. And it's not just the nerve root getting squeezed by the disc, it's a whole complex kind of cascade of events that we try to gather all the information. We try to test the strength of different muscle groups that are involved with supporting and stabilizing the area, understand how patients compensate for that, and can cause problems of their own. And if, it's treating the source is great, but treating, I guess, the source of the source, the contributing factors, leads to a more likely long-term benefit.
Yeah, bodies are complicated, right? So there's lots of layers. You know, I kind of sometimes use the analogy to my patients of, the body is just like dropping a rock in a pond. The initial ripple is going to be right next to the rock, but the next ripple could be 15 feet away. So in your body, like you said, like if you find some glute issues, that could, obviously contribute to a glute issue, but it could contribute to a knee issue, could contribute to a back issue, contribute to a lot of different things. So I think one of the things that a lot of your patients really like about you, because I see your patients after they see you, they love how thorough you are because you're checking all of these different things and how can all these different things be contributing to the pain that they're dealing with.
I'm not going to lie, Jesse. It's a little bit of paranoia that I experience. Oh my God, I don't want to miss this because this might be contributing. And if I miss this, then patient might not have that successful outcome they're looking for. So I'm constantly trying to make sure I check all my boxes. And honestly, the list of things to look and boxes to check increases because this is an expanding field and we don't have all the answers. But I'm trying to uncover, after years of trying, banging our head against the wall, trying to figure out what the heck is going on with this patient and how do I make this person better. Has seen great doctors and great, physical therapists or chiropractors and not making the progress that they're looking for, we have to try to ask why and what other systems might be at play, and I try to figure that out. It's nice getting the really simple, there's an acute injury, everything else is intact, and you just have to take care of that. Sometimes, because we see a lot of the complex, those are, breaths of fresh air, but still, that's not what we see on the regular. But we have to try to gather all the information in order to be successful.
Yeah, that's awesome. So I think one way to kind of help people understand what you do is to use it from a patient example. So do you have a success story of someone who maybe had back pain or some other type of pain that that maybe they weren't getting helped elsewhere, their pain was lingering, and then they came to see you, you helped them, and kind of walk us through maybe that story.
Yeah. So it's tough kind of measuring success because patients define success in different ways. They have different functional goals or symptomatic, goals for symptomatic relief. And, that could be patients that, had have never been able to lift their own child, their toddler, their parent, or wanting to go back to golf or whatever they enjoy, that kind of like activity, and because of a spine injury, and we try to again gather all the information and eventually get provide different kind of treatment options for them, collaborate with PT to try to get them to progressively strengthen, slowly continue to nurture that kind of healing of those injured structures so that they can support and do a lot of these kind of activities pain free. So we've been able to make patients better even after surgery. I've had patients that have had fusions and discectomies, and for some reason still have shooting pain in an arm or leg, and it just never recovered for some reason. And we've done kind of different kinds of treatments, like epidural PRP, for instance, and also treat the supportive structures around, and then they recover their strength, myotomal strength, 100%, even 6 to 12 weeks later. They're able to show me that C6 radiculopathy, that nerve root weakness and pain. The pain goes away and the strength becomes 100%, and it's just remarkable. It's like a high that you don't get tolerant to. It's so amazing watching patients get better, and then or a tear in a disc or degenerated disc that you treat with PRP, and then they can get back to golfing, like lifting their kid, or all these different kind of examples. It's just it's pretty remarkable.
Yeah, that's great. And I think the one thing or a couple things I want to really narrow in on there is you mentioned parents who have never been able to lift their kids. I think one thing that we hear all the time, and I think what a lot of people think is, you have back pain for a certain period of time, it means you're going to have pain for forever. Back pain is forever. Back pain is normal. And so what you're saying is, I don't want to put words
Not
in your mouth.
necessarily.
Yeah, exactly.
It could be years, it could be many years. I've had patients, thankfully. I'm grateful that they had some treatments, injection-based treatments coupled with physical therapy. Don't get me wrong, we do a lot of injections, but I get just excited for patients to achieve their goals injection free or even surgery free. But sometimes, it's one of the tools in our toolkit. Is after kind of doing that in-depth, comprehensive workup of what's going on and what is really worth targeting, then being very precise at treating these injuries under image guidance, followed by the necessary kind of protocol to rest and then slowly load, then working with you guys, and then they're able to make improvements that they might not have been able to achieve before, and some have been suffering for years.
Yeah, that's great. So if you've been having back pain for a long time, you don't have to live with it. There's
Yeah,
there's
you
no
don't.
reason 5 years, 10 years you can't overcome it. And the other thing I want to really dive into is you mentioned torn disc, ripped disc. There's a lot of fear about discs. I just had somebody in the clinic this week, he was terrified that he might have had a disc injury. I think a lot of people think, once you have a disc injury, it's never going to heal. So again, what you're saying is, even with a disc injury, it's not inevitable that you're going to have pain.
It's true. There are a lot of supportive structures around the spine that could be targeted. So, for instance, when a person bends forward, lifts something in front of them, and they tear one of their lumbar discs, and then there's swelling in the bone adjacent to that disc, a sign of some active degeneration of that disc that is pretty specific for back pain coming from the disc. That's not all that we need to look at. There are ligaments, muscles that are supposed to, support all those different cables around that spine structure that need to be evaluated. And sometimes targeting those alone can make a significant improvement where patients are not suffering so much. They might feel some of them might feel some pain when they bend and lift something heavy, but they're able to compensate and handle it much better. And overall, their suffering decreases and their function improves. But sometimes you can get away with that and just have the improvements there. Versus sometimes there is it might be worth directly targeting that injury with a very precise image guided treatment right into that injured disc.
Yeah, and I think a good example that we were talking in the pre-interview, we shared a client with, obviously without sharing any names. His backstory, dealing with pain for 10 years. He was terrified of his back. I remember when I first saw him, he didn't even want to tie his shoes. I asked him to pick up a 3 pound weight from the floor, and he looked at me like I was absolutely crazy. And I don't know if you remember exactly what you did to work with him, but do you remember kind of how you helped him? And then I'll kind of share where he is now.
So, this is somebody who's incredibly motivated to get better, wants to be very functional, very busy lifestyle, but obviously sets the time to get better. And that's like ideal patient, right? Had a lot of things going on. Had a lot of things going on around the spine. Had a lot of things going on within the spine. And this is a clear case that it's multifactorial. It's not just one thing, one magic injection is going to make everything go away. No, it needs to be comprehensive approach. And it did not happen overnight either. It was seeing that patient, evaluating, treating certain things that we find, reevaluating, hey, this cleared up. Now it's clear, and he would also be able to express, what he's actually experiencing. Hey, this improved, but now I'm really feeling it here. And we try using tools like diagnostic musculoskeletal ultrasound to try to identify those tears. We notice different weakness patterns. Why was he not firing that gluteus medius? There's an injury to the serratus posterior inferior, this kind of tendon that can actually be connected with, it's our connection between our upper and lower limb on the same side. It's not going to allow, if that area is injured, it's not going to allow you to fire your gluteus medius. It's not going to allow you to depress your shoulder blade. So that's something that's often overlooked that normally people don't even look at that. But hey, that gluteus medius, we could spend another half an hour talking about that alone, how important and critical that is to the pelvis, to the knee, going to cause tightness, compensatory tightness in the QL on the other side. It's going to load the medial knee, prevent proper tracking of the kneecap on the femur, all these different things. But some people just say, oh, just do clamshells and everything in your life will be great. It's not that simple. There's a reason why that muscle's not firing. There's a reason why same side shoulder, he had all kinds of chronic issues with that anterior shoulder. And that's part of the reason. Something was injured there that, that balance and that support system wasn't able to perform its job. So, we can identify that injury, we can treat it, and then he's able to fire that muscle. Then, working with you, he can progressively strengthen that muscle, stabilize things, and things don't get as irritated. But then we also, for him, targeted the epidural space because he was getting some symptoms down his leg. We targeted the disc, the disc that was actually affected because one of the discs, unfortunately, was almost too far gone, pretty collapsed. But the one that we were able to actually treat, we were able to make improvements there. So just because, an MRI, that's a clear cut example that just because an MRI shows, significant injury, one of the two discs, we didn't even target because it was so collapsed, you can't even access it. So there's no point in, trying to torture the patient by getting into an area that's inaccessible. So that's why I look at all the imaging, I gather all the information and really see how can I make this person's, where can I make the most improvement. And what we did target, I mean, he is pretty functional now. He's made us to the point where he's like, my back is not even bothering me. That's not even nearly the my concern. It's not even on my list. So I think that's a great example of collaborative effort and communication between you and me, where we talk about, hey, this is what I'm finding, and why don't we work on this? Or you tell me, hey, he's actually not able to fire this muscle. What can you do about that? So we could be more successful here, and the patient benefits from it.
Yeah, and I think you're underselling a little bit. When you say he's functional. I mean, he went from terrified of tying his shoes to he deadlifts now. He does burpees. He jumps. He does everything with his personal trainer. And I think that's great that you mentioned that. You mentioned he had a collapsed disc. That disc is still in the same shape that it was before, but he's still functioning. He's doing everything that he wants to do. So you don't have to totally stop your life because of a disc issue. So I think that's great.
Yeah. Just treating all the different areas, targeting the injured disc that we can access, treating the nerve roots in the epidural space that were causing some symptoms down the leg, had weakness in that distribution. Can we recover that weakness? Can we get it stronger? And then treating all the myofascial sources of weakness to, and really teasing out what's coming from where, then intervening and progressively strengthening. I think that's a pretty big win for us. So
Yeah.
I'm not trying to pat ourselves on the back, but just an example of working and collaborating with great people. I've had some success in the past. Yeah.
Yeah, and not even patting ourselves on the back. It's more telling his story and patting him on the back of all the work that he put into, but also just letting other people know that no matter what back pain you've had, you can get over it. So that's why I like sharing stories, is because it's a real life example of people overcoming things.
Yeah.
So one of the things that I helped him with was helping him understand and kind of busting some myths or redirecting some bad information that he had. So that's something that we do often. So what's one big health myth, or what's one big misconception about pain or recovery that you like to kind of talk with your patients about?
So a lot of my patients come expecting certain treatment options like PRP or some cellular procedures they might have heard about. And really, one of the things that I like to explain to them, it's just one, it's some of the tools in our toolkit, but it's not going to really be effective if you don't do the necessary upfront work to really figure out everything that's going on. And then when you do the treatment, if that is what we agree to, that's what the patient wants to pursue, it has to be done very precisely under image guidance. It has to be done, you have to put it right there, because otherwise, if you use image guidance, it's a shot in the dark and they're not going to get that benefit. And that's so hurtful to see if a patient has all that hope and investment in multiple ways, and they don't get the outcome they're looking for. And we try to optimize our chances of getting that positive outcome. That's one of the kind of treatment options that we do. But sometimes patients do, really need surgery. Another kind of thing that I like to explain to patients is that there is this field of non-operative orthopedic sports medicine, pain medicine, musculoskeletal care that is not, just pushing certain injections or, put like I only operate or anything like that. It's really trying to figure out what's going on and then based on what's going on, sending to the appropriate people. Sometimes that's not something that you can handle. Sometimes we see a fully torn rotator cuff tear that's fully retracted, and I tell patients honestly, I'm not going to do a treatment here that's going to all of a sudden make those two ends meet. You know what I mean? So it's not just kind of hey, here are the treatment options we have. Let's go down the list. It's really doing the necessary upfront work, trying to figure out what's going on, and then getting people to the right providers like yourself or like a surgeon, or sometimes it is something that we can intervene on and make an improvement in collaboration.
Yeah, I think collaboration is so important because we see people, we help a lot of people, but we can't help everybody. And you can't help everybody. Surgeons can't help everybody. So I think it's really important to work together as a team and say, hey, I can't, or I get this person to 75%. What can we do to get them to 100? Or so I love that collaborative approach, and that's something that I always look for when I'm trying to build somebody's health team out for them, is how open is another provider to being collaborative. So I think that's so important, and I love that you're doing that. And I also think it's a good message of, and I think a lot of people, pain sucks, and being in pain is hard. And one thing I think a lot of people would love is a quick fix or a quick injection or something like that. And talking about, there's a lot of work that goes in before and after that injection, or even before or after the surgery. So unfortunately, there's just not a quick fix for most things. So I love talking about, what do we need to do before the injection? What do we need to do after the injection? What can we do to make these things more successful? So I like that.
Sometimes we do get that one and done injection, and it is
Yep.
very rewarding. We like instant gratification, right? And I've had some patients where they get like some sort of like a radiating pain, a nerve entrapment that you could clearly see on the ultrasound, and be very specific and precise to release that restriction that's around that nerve so that it can actually send that signal. And then the weakness they had before and the symptoms completely gone. And it's great. Then they start, talking, and then everybody expects that kind of outcome. And then you run into, a lot of pressure, and it's a little heavy, but I love that. Or something as simple as, hey, you can't fire this muscle, and that's what's driving this. Let me put a little kinesio tape here. Look, now you can fire this. Work with your PT to kind of encourage that, and they get the positive results. That's so it's nice when we have that, but it is that's not what we see all the time. There's some patients, there's more of an effort required and more of a comprehensive approach. Yeah.
Yeah, I mean, the quick fix is always great, and if that happens, that's awesome. I just don't want people to expect it, like you said. If they come in with that expectation, often it makes your job harder, and it also makes it harder for them to kind of understand the whole plan that might have to happen for full recovery at least.
Yeah.
So this has been great. I think tons of great information. So if there was one message you want to leave people with, or one piece of health advice you wish everyone knew, what would that be?
It's really the letting patients know that we're here, this kind of field, this part of the whole continuum of musculoskeletal orthopedic care, that we are here to serve patients, to really try to find out what's going on, try to figure out how we got here, and send patients to the appropriate great providers in the area so that we can work together to make it better and keep it better, because patients think they don't really know about like physical medicine rehabilitation, or this is sports medicine, pain medicine. They so we have a lot to offer basically, and it can be very precise. It can be highly diagnostic at first, and there are interventions that we could potentially offer that are non-operative, and I don't know if patients they hurt their ankle and they want to get back to running, we're very focused on them achieving that functional goal as a team. And I think that's one of the big messages that we need to spread out there.
That's great. So I hope you've given a lot of hope to people today. So tell us about your new practice. How can people find you if they want to learn more? Just tell us a little bit more. Where can people find you, and tell us about your new practice?
So we opened a new practice in Rockville, Maryland. It's called Impact Sports and Spine, and we provide all kinds of different diagnostic workup treatments here. We work on I primarily work on the spine. My partner does a lot of the sports medicine and also provides various different treatments, gets patients back to whatever level of athlete they are. Tries to get them back to return to play and achieve those functional goals. And we can be very specific with our treatments. We can tailor the different options, and we don't just say, "Oh, you need to just do this." Right? Here are the options, and let's see what works for you, what fits what you're looking for most. And we've been very successful. This office hasn't been open for too long, but it's been a wonderful experience. And the ultrasound. We have ultrasounds here. We have a lab here. We offer different kinds of treatment options, and it's been a great learning experience with no regrets. It's been fantastic.
That's awesome. Do you have a website that people can find you at?
Yes, www.impactsands S&S like sports and spine, but it just sounds like impactsands.com.
Awesome.
And we have a full website and has a lot of information there and a phone number you can call. And if you'd like to schedule an appointment, have any questions, our number is 301-363-9693. And we look forward to seeing you.
Awesome. David, this has been great to catch up. It's been great to know you for a few years now. Thank you so much for your time.
Thank you. And thank you for everything over the years, all the successes we've had. It's been a real pleasure working with you.